This is All India Radio. We now bring you a special program on COVID-19. Good morning. I am Lalema Aneja Dang and with me is Subhadra Ramachandran. The headlines. Prime Minister Narendra Modi to interact with chief ministers via video conference this morning to discuss way ahead in fight against COVID-19. Prime Minister says mask is the most visible effect in fight against coronavirus, urges people to discard the bad habit of spitting in public. Recovery rate of COVID-19 patients in India improves to around 22%. Production capacity of PPE coveralls for medical personnel treating COVID-19 ramped up to over 1 lakh per day. Uttar Pradesh government bans all public functions till the 30th of June and Indian Institutes of Technology and Indian Institutes of Information Technology not to hike tuition fee for academic year 2020-2021. Prime Minister Narendra Modi will interact with chief ministers via video conference this morning. Discussion on the way ahead in the fight against the novel coronavirus is slated to be on top of the agenda in the conference. This will be the third video conference of the Prime Minister with chief ministers after the announcement of nationwide lockdown since last month. Here's more from our correspondent.
Prime Minister Modi announced the first lockdown last month after considering viewpoints of all the chief ministers. Even the announcement of its extension till 3rd May included views from across the states. With just a week remaining for the extended lockdown to end, the third meeting of Prime Minister Modi with the chief ministers is considered to be crucial in many aspects. Telangana has already announced lockdown till 7th of next month, whereas other states are monitoring daily updates to decide the future course. Government has earned laurels from across the world in its handling of novel coronavirus, and through a series of decisions it has ensured normalcy and availability of essentials. Anand Chaturvedi, AIR News, Delhi.
Prime Minister Narendra Modi has said that India's fight against corona is people-driven, and along with the people, the government and the administration are fighting the pandemic. Sharing his thoughts in the Mann Ki Baat program of All India Radio yesterday, Mr. Modi said each and every citizen of the country is a soldier in this battle and they are leading the battle. He lauded the resolve of the people as to how at each and every place people have come forward to help each other.
भारत जैसा विशाल देश जो विकास के लिए प्रयत्नशील है, गरीबी से निर्णायक लड़ाई लड़ रहा है, उसके पास कोरोना से लड़ने और जीतने का यही एक तरीका है और हम भाग्यशाली हैं कि आज पूरा देश का हर नागरिक जन जन इस लड़ाई का सिपाही है, लड़ाई का नेतृत्व कर रहा है। आप कहीं भी नजर डालिए, आपको एहसास हो जाएगा कि भारत की लड़ाई पीपल ड्रिवन है।
Mr. Modi said, in the changed paradigm due to corona, masks are becoming a part of the lives of people.
मास्क को लेकर भी धारणा अब बदलने वाली ही है। आप देखिएगा, मास्क अब सभ्य समाज का प्रतीक बन जाएगा। अगर बीमारी से खुद को बचना है और दूसरों को भी बचाना है, तो आपको मास्क लगाना पड़ेगा। और मेरा तो सिंपल सुझाव रहता है, गमछा।
Mr. Modi urged people not to get caught in the trap of overconfidence and not harbor a feeling that if corona has not yet reached their city, village, street or office, it is not going to reach now. Mr. Modi said, "Do gaz duri hai zaruri" should be our mantra and people should maintain a distance of 2 yards and keep themselves healthy. Mr. Modi said it had been a part of the bad habits that people would spit anywhere and it presents a serious challenge both to cleanliness and health. He said people must eradicate the spitting habit in public.
अब वो समय आ गया है कि इस बुरी आदत को हमेशा हमेशा के लिए खत्म कर दिया जाए। कहते भी हैं कि बेटर लेट देन नेवर, तो देर भले हो गई हो लेकिन अब ये थूकने की आदत छोड़ देनी चाहिए। ये बातें जहां बेसिक हाइजीन का स्तर बढ़ाएंगी, वहीं कोरोना संक्रमण को फैलने से रोकने में भी मदद करेगी।
Underlining the government's commitment to help the needy and the poor, the Prime Minister said money is being directly transferred into the accounts of the poor as part of the Pradhan Mantri Garib Kalyan package. Expressing his deepest regards for the medical services personnel across the country, Mr. Modi said doctors, nurses, paramedical staff, community health workers and all such personnel who are working round the clock to ensure a corona-free India. He said, we need to ensure their safety and the ordinance that has been issued recently is a step in this direction. Mr. Modi urged people to follow the corona-related protocol to boost immunity by the Ministry of Ayush.
सोशल मीडिया पर देखिए हर तरफ इम्यूनिटी बढ़ाने के लिए किस तरह से भारत के आयुर्वेद और योग की चर्चा हो रही है। कोरोना की दृष्टि से आयुष मंत्रालय ने इम्यूनिटी बढ़ाने के लिए जो प्रोटोकॉल दिया था, मुझे विश्वास है कि आप लोग इसका प्रयोग जरूर कर रहे होंगे। गर्म पानी, काढ़ा और जो अन्य दिशा निर्देश आयुष मंत्रालय ने जारी किए हैं, वो आप अपनी दिनचर्या में शामिल करेंगे तो आपको बहुत लाभ होगा। जैसे विश्व ने योग को सहज स्वीकार किया है, वैसे ही हजारों वर्षों पुराने हमारे आयुर्वेद के सिद्धांतों को भी विश्व अवश्य स्वीकार करेगा।
Dr. M.C. Das, an eminent educationist and political analyst, says Prime Minister Narendra Modi's Mann Ki Baat was greatly motivating.
Prime Minister Modi's Mann Ki Baat is highly motivating and confidence building, and people are really getting inspired by the speech of our beloved Prime Minister. The whole nation is fighting. Along with the government, people are fighting. And Modi ji says that every Indian is a soldier. The fight against coronavirus is a people-driven fight. And the future generations in our country will discuss this as a remarkable people-driven fight against COVID-19.
The recovery rate of COVID-19 patients in India has improved to around 22%. Currently, the mortality rate of such patients is 3.1% in the country compared to 7% at the global level. This was stated by Health Minister Dr. Harshvardhan yesterday while visiting the Trauma Center of All India Institute of Medical Sciences, New Delhi, to take stock of preparedness to overcome COVID-19. The minister said 5,913 people have been cured till now and the coronavirus situation in the country is improving. Continuing his update about the COVID-19 situation, Dr. Harshvardhan said, as on date, 283 districts have not reported any COVID-19 case till date. 64 districts have not reported a fresh case since the last 7 days. Elaborating on the adequacy of the ventilators, oxygen supplies and ICUs, the Health Minister said, comparing the number of active patients who are currently hospitalized, only 2.17% patients have been admitted in ICU, 1.29% patients have required oxygen support and mere 0.36% are on ventilator.
Health Ministry issued a detailed guideline for bringing back human remains of confirmed or suspected COVID-19 patients in the country. However, the ministry asserted that importation of human remains of such cases is not recommended. In cases where human remains of suspected or confirmed COVID patients arrive in the country, validation of cause of death, no objection certificate from the Indian mission, and embalming certificate has to be produced as a required precautionary step. The guidelines state that the airline and airport health officer shall ensure that all preventive measures related to the importation are followed. The production capacity of coveralls required by medical personnel treating COVID-19 cases in the country has been ramped up to more than 1 lakh per day. Bengaluru has become a major hub for PPE coverall production in the country to combat COVID-19 cases. Nearly 50% of the coverall production in the country is from Bengaluru. PPE coveralls are also being manufactured by approved production units in Tirupur, Chennai and Coimbatore in Tamil Nadu, Ahmedabad, Vadodara in Gujarat, Pagwara and Ludhiana in Punjab, Kolkata, Delhi, Noida, Gurugram and few other places. The cumulative production till date is approximately 1 million coverall units. This is a major boost to providing protection to healthcare workers in the front line of war against COVID-19. The PPE kits are being sent to the states by the Health Ministry as per requirement. Government has rejected a claim doing the rounds on WhatsApp app that Ayush Ministry has permitted homeopaths to treat COVID-19 patients. In a tweet, Press Information Bureau termed it as incorrect. It said the ministry has only created a mechanism for short-term research proposals to evaluate the role of Ayush interventions for COVID-19.
Over 684 tons of essential and medical cargo have been delivered across the country under Lifeline Udan during COVID-19 lockdown. Lifeline Udan flights are being operated by Civil Aviation Ministry to transport essential medical cargo to remote parts of the country to support India's war against COVID-19. Our correspondent has the details.
Lifeline Udan flights have covered over 376,000 kilometers of aerial distance to transport essential medical cargo to remote parts of the country. 383 flights have been operated under Lifeline Udan by Air India, Alliance Air, Indian Air Force and private carriers. Helicopter services including Pawan Hans Limited have been operating in Jammu and Kashmir, Ladakh, Islands and northeastern region, transporting critical medical cargo and patients. Pawan Hans have carried around 2 tons of cargo covering a distance of over 6,000 kilometers. Domestic cargo operators SpiceJet, Blue Dart and Indigo are operating cargo flights on a commercial basis. Bulk of the cargo comprises products like medical equipment, testing kits, personal protective equipment, masks and gloves. With Dipendra, Anand Chaturvedi, AIR News, Delhi.
Union Minister Nitin Gadkari has asked Indian overseas students to make concerted efforts to convert COVID-19 adversity into an opportunity. Interacting with overseas Indian students via video conferencing, the Minister for Road Transport and Highways and MSME said that as we are moving ahead, restarting various activities, all of us need to follow all the precautions regarding health protocols to prevent transmission of COVID-19 virus. The minister said efforts need to meet not only Indian demand but also cater to the global market as many companies are looking to shift away from China. Mr. Gadkari called upon the young Indian students studying abroad to contribute to this goal in a big way. Indian Institutes of Technology IITs and Indian Institutes of Information Technology IIITs will not hike tuition fee for any course for the academic year 2020-2021. This was stated by Human Resource Development Minister Ramesh Pokhriyal Nishank in New Delhi yesterday. He said the decision was taken after consultation with the chairman of the Standing Committee of the IIT Council and directors of IITs. The HRD minister said, in case of the centrally funded IIITs, it has been decided that the standard 10% hike in the tuition fee for undergraduate programs will not be implemented this year. He said he has also requested the IITs run in the public-private partnership mode not to hike the tuition fee for the coming academic year for any of their courses.
This is All India Radio giving you a special news program on COVID-19. Let's take a look at the headlines once again. Prime Minister Narendra Modi to interact with Chief Ministers via video conference this morning to discuss way ahead in fight against COVID-19. Prime Minister says mask is the most visible effect in fight against coronavirus. Urges people to discard the bad habit of spitting in public. Recovery rate of COVID-19 patients in India improves to around 22%. Production capacity of PPE coveralls for medical personnel treating COVID-19 ramped up to over 1 lakh per day. Uttar Pradesh government bans all public functions till 30th of June. And Indian Institutes of Technology and Indian Institutes of Information Technology not to hike tuition fee for academic year 2020-2021. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
All the popular programs of Doordarshan now on DD Retro. Mahabharat, Shaktiman, Sankat Mochan Hanuman, Bunyad, Dekh Bhai Dekh, Chanakya, Upanishad Ganga. To watch all the popular programs of Doordarshan now on DD Retro, contact your local cable operator.
लोकप्रिय धारावाहिक महाभारत प्रतिदिन दोपहर 12 बजे और शाम 7 बजे डीडी भारती, फ्री डिश और अन्य डीटीएच चैनल पर। सब्सक्राइबर्स अपना चैनल नंबर नोट करें: DD 60, टाटा स्काई 1194, एयरटेल 151, सन डायरेक्ट 326, वीडियोकॉन DTH 480, डिश टीवी 197 और डेन 522। समय याद रखें, दोपहर 12 बजे और शाम 7 बजे। प्रतिदिन देखें लोकप्रिय धारावाहिक महाभारत।
अथ श्री महाभारत कथा।
Uttar Pradesh government has banned all public functions till 30th of June. Chief Minister Yogi Adityanath has directed officers that no public gatherings should be allowed in the state till June 30 amid the coronavirus outbreak. He said further decision will be taken depending on the situation. The move comes after the Chief Minister held a meeting with chairpersons of 11 committees of the state over the COVID-19 situation. Maruti Suzuki, the automobile giant, is now spearheading the production of low-cost ventilators in the country and helping the government in the fight against COVID-19. The production is going on in Gautam Buddha Nagar, Uttar Pradesh, where the company is supporting Agua Healthcare, a start-up to scale up ventilator production. Our correspondent has more details.
R.C. Bhargav, chairman of Maruti Suzuki Industries Limited, spoke exclusively to AIR News and said that government approached them in the end of March and within 20 days, the production increased manifold.
20 दिन हुए जब से काम शुरू किया है हमने और डेली प्रोडक्शन रेट जो है वो 300 वेंटिलेटर एक दिन में हम बना लेते हैं और इरादा ये है कि इस महीने के खत्म होते होते उस 300 को भी और बढ़ा के 400 कर देंगे। मतलब ये है कि एक महीने में ही 10,000 वेंटिलेटर बन सकते हैं। वो एक महीने में बनाना दुनिया में माना जाएगा काफी बड़ी कंपनी हो जाती है।
The low-cost ventilators were designed by Agua Healthcare and Maruti Suzuki is enhancing the production by pouring in the vendors and doing the quality control. Mr. Bhargav thanks central and UP government for providing support related to production and other issues.
यहाँ के जो लोकल अथॉरिटीज हैं उनका बड़ा अच्छा सहयोग मिला और नोएडा अथॉरिटीज के सहयोग से हमने बहुत जल्दी में सारे जो परमिट वगैरह होने थे सब चीजों में बड़ी सहूलियत हो गई।
Now cumulative production at the production center in Gautam Buddha Nagar has crossed 1200 units. Sushil Chandra Tiwari, AIR News, Lucknow.
In Gujarat, total number of COVID-19 cases has gone up to 3,301, with 230 new cases reported yesterday. Briefing media persons at Gandhinagar last evening, the Principal Health Secretary Dr. Jayanti Ravi said that 151 patients died so far, while 313 patients have been cured and discharged from various hospitals. She said that the conditions of 2,810 patients are stable, while 27 patients are on ventilators. AIR Ahmedabad correspondent reports that out of 230 new cases, 178 cases reported from Ahmedabad only.
Ahmedabad city has become the hotspot of COVID-19, where the total number of cases has gone up to 2,181. 6 wards of Ahmedabad city have been declared as COVID containment zones. 2 more bridges connecting the old Fort city have been closed by the police. The state government has withdrawn the permission of opening of small shops and businesses in Ahmedabad, Surat, Vadodara and Rajkot city area. According to the state health department, total 10,500 beds are available in 61 dedicated COVID special hospitals. 1,061 ventilators are available in government hospitals, while 1,700 ventilators are available in private hospitals. Order for 1,000 more ventilators has also been placed by the state government. Yogesh Pandya, AIR News, Ahmedabad.
Senior Congress leader and councillor in Ahmedabad Municipal Corporation, Badruddin Sheikh, passed away late last night following COVID-19 infection. He was 68 and active in politics and public life. The number of COVID-19 cases in Maharashtra crossed the 8,000 mark yesterday after 440 more people, 358 of them from Mumbai alone, were found infected. On Saturday, the state had reported 811 coronavirus positive cases, the highest single-day rise. The State Health Department said with 440 new cases, the number of COVID-19 patients in the state mounted to 8,068. Meanwhile, the COVID-19 death toll in the state climbed to 342 after 19 more people succumbing to the viral infection in the day. So far, 1,188 patients across the state have been discharged after recovery. The Mahim Kabristan Trust in Mumbai has said that burial of COVID-19 victims will be free of cost at their cemetery. It is one of the cemeteries mandated by Brihan Mumbai Municipal Corporation to bury community members who die due to the coronavirus infection.
As the city is grappling with a rising number of coronavirus cases, Brihan Mumbai Electric Supply and Transport (BEST) has converted 7 of its AC mini buses into ambulances. BEST General Manager Surendra Kumar Bagde informed that these semi-ambulances will be used to ferry suspected coronavirus patients or those who have only mild infection to COVID-19 care centers. In Tamil Nadu, 64 people were tested positive for COVID-19 yesterday, while 60 others were discharged. Though the total infection count has surged to 1,885, the active case load has come down to 838. The death toll has gone up to 24 as another person succumbed to the disease in the last 24 hours. More from our correspondent.
A positive in Tamil Nadu is that Krishnagiri district is free from the pandemic so far, and 4 districts including Kanyakumari, the Nilgiris, Erode and Ranipet have not reported any fresh case for more than 11 days. 7 other districts have less than 15 cases only. To augment testing, laboratories in the state have been increased to 41, including 30 in government hospitals. As Chennai has the maximum caseload, the administration has planned to enhance testing in the city manifold. Meanwhile, for boosting the immunity of the frontline staff who are treating the patients and are involved in containment and relief efforts, the government has decided to give them zinc and multivitamin tablets for 10 days from today. Jai Singh, AR News, Chennai.
The Interministerial Central Team IMCT has reviewed various measures being taken by the state government to contain the spread of coronavirus in Hyderabad. A report.
Director General of Police Mahendra Reddy explained the central team about the steps taken by the state police to ensure total lockdown in Hyderabad. He also informed the team about the security measures taken up by them at all hospitals where COVID-19 patients were undergoing treatment and suspects placed under quarantine. The team also interacted with farmers at Raitu Bazar in Mehdipatnam and inquired about the transportation of stocks to the market. The central team will visit the Greater Hyderabad Municipal Corporation Control Room, Gandhi Hospital, the nodal hospital for COVID-19 treatment, and likely to meet State Chief Secretary before concluding its visit. Lakshmi, AR News, Hyderabad.
Meanwhile, a 75-year-old has been discharged after recovery. Sangareddy district has been declared COVID-19 free by Finance Minister Harish Rao.
In Himachal Pradesh, while the state government is ensuring to provide all essential facilities to the migrants and needy in curfew, youth from different religious backgrounds in Chamba district are rendering exemplary services. Here's a report.
Amid statewide curfew over the coronavirus pandemic, the youths of different religions in Chamba district under the banner of Chamba Saviors have come forward to serve underprivileged sections of the society during crisis. The young adults together pack the ration and transport it to the needy people. Organization President Charanjit Singh says all youths irrespective of their religion are serving the society with high spirit.
चंबा सेवियर सोसाइटी में सभी धर्म के लोग मिलकर जो हम राशन बांट रहे हैं और लगभग हम 80 परिवारों को इन 3 एरियाज में राशन बांट चुके हैं। इसमें हम लोग जो है चावल, आटा, घी, रिफाइंड सब कुछ एक हफ्ते का सामान एक परिवार को दे रहे हैं और आगे भी हम इसी तरह सामान देते रहेंगे। अगर लॉकडाउन बढ़ता है तो हमारा जो सोसाइटी है चंबा सेवियर्स, इसके साथ जो है हमारी मुस्लिम एसोसिएशन है वो भी साथ में है, हिंदू धर्म के संस्थाएं भी हमारे साथ जुड़ी हुई हैं और उसके अलावा क्रिश्चियन सोसाइटीज भी हैं जो हमारे साथ जुड़ी हैं और आगे हम उम्मीद करते हैं कि जो हमारा ये भाईचारा ऐसे ही बना रहे।
Someone has rightly said unity is strength. The Chamba Savior made this thing meaningful and has become an example for the others in the society. With Vikas Thakur report from Chamba, Sanjeev Sundrial, AR News, Shimla.
In Madhya Pradesh, labourers of the state stranded in other states have started returning to their homes. Our correspondent reports more than 1 lakh labourers of Madhya Pradesh have stranded in different states due to lockdown. The district administrations in Karnataka are making arrangements to transport stranded labourers to their native place of residence. These agriculture and construction workers are stranded in the state since the lockdown was announced on March the 24th. They were kept in hostels and shelter homes and provided food, clothing, medical checkup and personal care. A nodal officer is conducting the shifting operation by ensuring the social distancing and certifying workers that they are free from COVID-19 infection.
Karnataka Milk Federation has opened its kiosks and milk booths across the state to farmers willing to sell their produce directly to consumers. In Assam, 300 industries are operating now, maintaining guidelines of the centre. Talking to AIR, Transport and Industry Minister Chandra Mohan Potawari said that all these companies have given undertaking to the Deputy Commissioners to adhere to centre's guidelines. Keeping the spirit of oneness and charity alive in the holy month of Ramzan amid COVID-19, a group of 12 girls have come together in Doda district of Jammu and Kashmir to stitch masks for free distribution among the needy. The fasting girls plan to hand over the first installment of 5,000 masks to the district administration by Wednesday.
In our series, Experts Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Talking to AIR News, Dr. Sarita Gulati, senior cardiologist in Manipal Hospital, New Delhi, said people should take care of their hygiene and other preventive measures to contain the spread of the novel coronavirus.
Most important is maintain social distancing, avoid crowding and crowded places, maintain personal hygiene, cover your nose and mouth while coughing and sneezing, wear mask. Any mask is good for use by public. Practice frequent hand washing with soap, water or alcohol-based sanitizers. Regularly clean your mobile phones, electronic items, keys and wallets.
Dr. A.B. Day, Head of Geriatrics Department in All India Institute of Medical Sciences, AIIMS, said that senior citizens need to take special care of themselves in the light of COVID-19 and should remain active and engaged throughout the day.
It is important that older people should stay at home, wash their hands as frequently as possible, use a mask and avoid getting out and interacting with people who may have the similar disease. It is important that they eat normally and remain active and mobile. All their medications for the existing diseases should be continued in the same dose.
Researchers at Central Institute of Medicinal and Aromatic Plants in Lucknow have developed 2 scientifically proven herbal products which can boost immunity of people. CIMAP, a constituent laboratory of the Council of Scientific and Industrial Research, has decided to transfer the technology of its herbal products Sim Poshak and herbal cough syrup to the entrepreneurs and startup companies.
Veteran actor Ajay Devgan has called upon the people to download Arogya Setu app to ward off coronavirus. He described the app as a new bodyguard of the people.
Good morning, sir. आप कौन? सर मैं आपका नया बॉडीगार्ड सेतु सेतु लेकिन मेरे पास तो ऑलरेडी बॉडीगार्ड्स हैं सर मैं एक अलग टाइप का बॉडीगार्ड हूँ कोरोना वायरस से आपकी बॉडी को सिर्फ सेतु ही गार्ड कर सकता है कोरोना वायरस से वो कैसे सर वो ऐसे कि मैं आपको पहले ही बता देता हूँ कि आपको कोरोना वायरस से कोई खतरा तो नहीं अच्छा आपके आसपास कोई कोरोना पॉजिटिव हो तो मैं आपको पहले ही अलर्ट कर देता हूँ कंटिन्यू सर और तो और मैं आपको ये भी बताता हूँ कि आपसे आपके परिवार वालों को कोई खतरा तो नहीं मुझसे मेरी फैमिली को क्या खतरा होगा यार सर जानबूझ के थोड़ी अगर अनजाने में आप किसी कोरोना पॉजिटिव इंसान के टच में आ गए तो मैं आपको फौरन अलर्ट कर दूंगा ताकि कहीं आप इस बीमारी को अपनी फैमिली तक न पहुंचा दें और ये सब सिर्फ मेरे लिए सिर्फ आपके लिए ही नहीं सर भारत सरकार ने मुझे 130 करोड़ हिंदुस्तानियों की रक्षा के लिए हर एक का पर्सनल बॉडीगार्ड बनाया है
The News Services Division of All India Radio in its bilingual phone-in program today will bring you a special discussion program on COVID-19. Dr. Sunil Raheja, senior physician, will participate in the discussion. Listeners can ask questions to the experts on toll-free telephone number 1-800-115767. Repeat 1-800-115767. And now an overview of today's newspapers covering COVID-19 stories. A report in Business Standard says that vaccine major Pune's Serum Institute of India has plans to start production of COVID-19 vaccine developed by Oxford University in 3 weeks. Spraying out virus the Ayurvedic way is another Business Standard headline. The disinfection tunnel at Venkateshwara entrance uses Rajat Bhashma. Actor Manikantan Achari tied the knot with Anjali in a simple ceremony at a temple in Irur, Kochi and donated funds earmarked for wedding to the Chief Minister's Relief Fund, reports The Hindu. The number of times messages are forwarded on WhatsApp has fallen by 70% globally in 3 weeks after curbs were introduced in forwarded messages, says the Hindustan Times report. Due to closure of hotels and postponement of weddings, farmers in Chel Valley in Himachal Pradesh are using exotic vegetables. And National Digital Library of India has opened up its 35 million strong digital contents, making available, which means e-books, question paper, lecture materials, etc. to help people study at home, reports the Hindustan Times.
And now the headlines. Prime Minister Narendra Modi to interact with chief ministers via video conference this morning to discuss way ahead in fight against COVID-19. Prime Minister says mask is the most visible effect in fight against coronavirus urges people to discard the bad habit of spitting in public. Recovery rate of COVID-19 patients in India improves to around 22%. Production capacity of PPE coveralls for medical personnel treating COVID-19 ramped up to over 1 lakh per day. And Uttar Pradesh government bans all public functions till the 30th of June. And that's the end of this special news program on COVID-19.